Congratulations! You have reached the 5th week of your pregnancy, which marks the beginning of your 2nd month of pregnancy. At this stage, your baby is still very small, but he is growing and developing rapidly. Thank you so much for tuning into our videos. We notice that only 2.1% of our audience is currently subscribed to our channel. If you're enjoying our videos and find them helpful, we encourage you to hit that subscribe button and turn on notifications. It only takes a few seconds, and it means the world to us. Baby development in 5th weeks of pregnancy. During the 5th week of pregnancy, your baby is considered an embryo and is undergoing rapid development. Here is a breakdown of what's happening during this stage. Neural tube formation. One of the most important developments during the 5th week of pregnancy is the formation of the neural tube. This tube will eventually develop into the brain and spinal cord. Heart development. Your baby's heart is also beginning to form during this stage. It starts as a simple tube, but will eventually divide into 4 chambers and begin beating. Limb buds. Your baby's limb buds are beginning to form, which will eventually develop into arms and legs. Digestive system development. Your baby's digestive system is also starting to develop during this stage. The mouth, stomach, and intestines are beginning to form. Umbilical cord formation. The umbilical cord, which connects your baby to the placenta and provides nutrients and oxygen, is also beginning to form during this stage. Overall, your baby is about the size of a sesame seed during the 5th week of pregnancy. While it may seem small, it's important to remember that this is a crucial stage in your baby's development. Beta human chorionic gonadotropin, HCG Test. This hormone is produced by the cells that will eventually form the placenta, and levels of HCG rise rapidly in early pregnancy. Most home pregnancy tests claim to be over 99% accurate when taken on the first day of a missed period. If you have taken a home pregnancy test and it's positive, it's important to confirm the result with a healthcare provider. They can perform a blood test that detects HCG levels in your blood, which is more accurate than a urine test. A beta HCG test can be done as early as 11 days after conception and can provide more accurate results than a home pregnancy test. In the 5th week of pregnancy, HCG levels can range from 18 to 7,340 miu/ml. However, it's important to note that HCG levels can vary widely between individuals, and a single test result may not provide a complete picture of the pregnancy. What questions should I ask to healthcare provider in my 5th weeks of pregnancy? It's important to have open communication with your healthcare provider throughout your pregnancy, so don't hesitate to ask any questions that you may have. Here are some questions that you may want to consider asking during your 5th week of pregnancy. What prenatal vitamins should I be taking? Your healthcare provider will likely recommend a prenatal vitamin that contains folic acid, iron, and other essential vitamins and minerals. These vitamins are important for the development of your baby's brain, spine, and other organs. What should I be eating during pregnancy? It's important to eat a healthy, balanced diet that includes a variety of fruits, vegetables, whole grains, lean protein, and dairy products. Your healthcare provider may also recommend that you avoid certain foods, such as raw or undercooked meat, fish with high levels of mercury, and unpasteurized dairy products. Are there any foods or activities I should avoid during pregnancy? Yes, there are certain foods and activities that you should avoid during pregnancy to protect the health of your baby. Your healthcare provider may recommend that you avoid alcohol, tobacco, caffeine, and certain medications. They may also advise you to avoid certain activities, such as contact sports, hot tubs, and saunas. How much weight should I be gaining during pregnancy? The amount of weight you should gain during pregnancy depends on your pre-pregnancy weight. Generally, women who are of normal weight should gain between 11 to 15 kilograms during pregnancy. Women who are underweight may need to gain more, while women who are overweight may need to gain less. Your healthcare provider can give you personalized advice on weight gain. What symptoms should I expect during pregnancy, and when should I be concerned? Some common symptoms of pregnancy include fatigue, nausea, breast tenderness, and frequent urination. While these symptoms are normal, you should contact your healthcare provider if you experience severe or persistent symptoms, such as abdominal pain, heavy bleeding, or fever. When should I come in for my first prenatal appointment? Your first prenatal appointment should be scheduled as soon as possible after you find out you are pregnant. This appointment usually occurs around 8 to 12 weeks of pregnancy. Are there any prenatal tests that I should consider? There are several prenatal tests that you may consider, such as blood tests, ultrasounds, and genetic screening. Your healthcare provider can recommend which tests are appropriate for you based on your medical history and other factors. What kind of exercise is safe during pregnancy? Exercise is generally safe during pregnancy and can help you maintain a healthy weight and prepare for childbirth. Your healthcare provider can recommend safe exercises based on your fitness level and medical history. What can I do to manage morning sickness or other pregnancy symptoms? There are several strategies you can try to manage morning sickness and other pregnancy symptoms, such as eating small, frequent meals, staying hydrated, getting enough rest, and taking over-the-counter remedies such as ginger or vitamin B6. Your healthcare provider can recommend additional strategies if necessary. Are there any resources or support groups for pregnant women that you recommend? Your healthcare provider may be able to recommend resources or support groups for pregnant women in your area. Additionally, there are many online resources available, such as pregnancy apps and online communities, that can provide support and information throughout your pregnancy. Checklist for 5 weeks pregnant. Manage stress. Pregnancy can be a stressful time, but it's important to manage stress as best you can. Try relaxation techniques like deep breathing, meditation, or prenatal yoga. You can also try talking to a trusted friend or family member, or seek support from a therapist or support group. Avoid harmful substances. It's important to avoid harmful substances during pregnancy, including smoking, alcohol, and drugs. These substances can harm your baby's development and increase the risk of complications during pregnancy and childbirth. Consider genetic testing. Your healthcare provider may recommend genetic testing to check for certain genetic conditions that could affect your baby's health. Talk to your healthcare provider about whether genetic testing is right for you. Educate yourself. Pregnancy is a time of many changes, and it's important to educate yourself about what to expect. Consider reading books, attending childbirth classes, or joining online forums to connect with other expectant parents. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are posted.